Hi everyone. This PowerPoint will be focused on the importance of providing end-of-life care and what we as nurses can do to maximize comfort during this process. Upon completion of this presentation, you guys will be able to explain the meaning of end-of-life care, describe 3 nursing care interventions when providing care to the patient at the end of life, and lastly, recognize the unique needs of the patient and their loved ones at the end of life. Nursing care at the end of life incorporates interventions that are supportive of the dying patient's needs, such as developing a unique pain care plan if a patient is exhibiting signs and symptoms of pain. The dying process is a harsh reality and can be demanding even for the most experienced nurses, including you grad nurses, but becoming more knowledgeable in this area can help prepare you to care for these patients. No death experience is knowable. So in other words, end-of-life care will be individualized to each patient's experiences. Some people may rapidly decline, while others may have a steady, more gradual death experience. The exact definition for end-of-life care is unclear. However, many relevant healthcare decisions, such as patients requiring aggressive treatment for advanced cancer like chemotherapy or even a hospice referral, are dependent on the expected time of survival after medical examination. Patients at the end of life and their families have distinctive physical, emotional, spiritual, and cultural needs. As nurses, it is essential to assess the patient's abilities in coping with their end-of-life needs. So for instance, a patient who is at the end of life may experience difficulty breathing, exhibit signs of tachypnea. The nurse can consider using oxygen therapy, or in consultation with the attending doctors or even palliative care. Patients at the end of life can benefit from low-dose opioids like morphine to alleviate the sensation of being out of breath. Psychological support for patients is also important, discussing with them their fears, frustration, anger, helping them get situated for any of those end-of-life needs can help the patient and family cope better with the end-of-life process. Spiritual needs are important to incorporate in the nursing care plan for this patient. There may be particular religious faith that they follow. They may request a chaplain, a member of the clergy to come up and pray. And lastly, cultural is also very important because some cultures have different traditions about the dying process, and it's important to acknowledge. I cannot stress the importance the role a nurse has on promoting comfort for the patient and their loved ones at the end of life. Communication is vital. One thing that stood out to me as an oncology nurse was the lack of communication between some nurses and the dying patient and family members. For some nurses, it was because they felt too emotionally unstable with the current situation, and unfortunately, other nurses just lacked effective communication skills. It's very important to recognize that just because the patient may be in their final days or hours, dignity should still be maintained. Simple essential measures like providing oral hygiene and cleaning the patient's face and eyes can make all the difference in the world to the patient and their loved ones. The death and dying experience never becomes easier. It can and it will be challenging, but always keep in mind that you as a nurse play a huge role in providing comfort to the patient and their loved ones at the end of life. Thank you all for your time. I appreciate it.